So research is the future of medicine. If we stop doing research, there is no future. If we become stagnant and we don't improve what we're doing, then what's the point of, what's the point of being a doctor? As a doctor, it's like any other field in the world. You just have to keep on improving yourself and becoming better. It's like a car. Cars, are constantly getting better. As physicians and surgeons, we have to be constantly better. And implants have been stagnant for a while. They are improving, but there is a lot of area for improvement, and for us to make them better. We conduct research on procedures on how to make the implants better, last longer, have less complications, how we can perfect and hone our skills in terms of getting faster, easier outcomes for patients, but also being able to do these surgeries at outpatient and getting patients out of the hospital quickly with less anesthesia, less demands on the patients. And so our goal and what we should be doing as surgeons is that continuously conduct research that's going to allow us to better ourselves, better our outcomes, and better our patients' quality of lives, and give them, better lasting solutions to their problems. I would like to take medicine in the direction of what we do as sexual medicine specialists is we work and we focus on quality of life. We're not, treating cancer, we're not curing cancer, but we are improving patients' quality of life. People are getting older, men are getting older, but they're still sexually active. If you look at data, it shows that men in their 70s and 80s, about 30, sometimes even 60% of men are still sexually active. So these men, we need to make sure that their quality of life is good. And in that regard, the way I look at it is continuously improve the aspects of medicine that are related to quality of life, and in terms of improving our ability to give less and less invasive options to patients, which are going to allow them to live longer, but not only live longer and better. Whatever we do and whatever we treat, because we are treating quality of life, the end goal of our options and our treatments is to make our patients happy. That's the end goal. We are not curing like I said, a cancer. What we're doing is our main objective is to improve quality of life and make patients happy. So whenever the patients are happy, to me that is success, and that makes me happy. And I see that every day because we treat as sexual dysfunction. We have a lot of patients who come and see us. There are couples who either have marital problems because they're not able to have intercourse, or they haven't had sex in many, many years and have just given up on it because they think it's not an option. A penile implant, for example, is a procedure that we can give to these patients, and then afterwards they're able to resume sexual intercourse. Sometimes relationships are fixed. Their quality of life is certainly much improved, and they are happier. And when they are happier and they have good outcomes, when they come to the clinic, there's nothing that makes a surgeon happier than seeing a happy patient in the clinic, thanking them or bringing them a small gift or a small hug or a kiss or something to thank them for what they've done for them. And as a surgeon, there's nothing that makes me happier than seeing my patients happy with the outcomes of what we've done for them. So a lot of the medical research in the past was conducted towards outcomes. A lot of the research right now is focused on how to improve patients' experiences. A lot of it is related to how we're making our patients happier and how we're providing better satisfaction to our patients. And to that effect, if you notice, more and more questionnaires in every single field of medicine are coming about, and a lot of these questionnaires are related to how, patient satisfaction, how patients are happy with improvement with procedures and outcomes, but also a lot of the questionnaires are related to bother and to happiness scales. And this is where we should be focused in medicine. Obviously, we have to improve the treatments that we offer, but we have to also make sure that these treatments that we're offering to patients translate to better patient satisfaction and better patient quality of life. And I think this is something as physicians and as surgeons we should make sure, then we should strive towards always keeping in mind that the patient is not just a number. A patient is a person, and a patient we have personal relationships with these patients, and we have to keep these kind of like making sure that these patients are treated as human beings and that we care about them personally. I kind of lost it a little bit over there at the end. I think prosthetic urology should continue to improve. I think prosthetic urology should be more accessible to more patients. There are many patients who do not know about prosthetic urology. There are many patients who need penile implants and whose penile implants might improve their life significantly. So I think in terms of prosthetic urology, there are different things we need to look at. One is patient access. So more patients should have access, and not only in developed countries, but in most countries of the world, because ED is very prevalent. That's the first thing. The second thing is I think prosthetic implants have to continue to improve and become more and more easier for patients to use. And this is we strive as making the implants better every day. And third is we also have to strive to making the implants be associated with lesser complications, and this is on a daily basis becoming the case. And we should continue to train others and improve ourselves so that our outcomes will continue to improve and that we can have higher and higher satisfaction with our patients.